we are a health profession shortage area in eastern and central Washington because of the lack of mental health services. What we find with mental health and addictions problems is that it's often environmental. It depends a lot on your socioeconomic status and isolation, and that's why rural areas have a particular problem with this. A lot of the returning veterans who have post-traumatic stress disorder, as well as addictions and pain, and often traumatic brain injuries, are not comfortable living in cities, even the size of Spokane. And so they're actually living out in these rural areas with a lot of complex mental health and addictions problems. I'm fortunate to teach the first-year medical students here at WSU Spokane human behavior and behavioral medicine. So one of the challenges will be with integrating behavioral medicine into primary care, which is essentially what the Affordable Care Act does. The idea is to provide more affordable insurance for up to 30 million more people. The problem is that 30% of them will have a mental health or addiction problem, and primary care is not staffed or prepared to take on that specialty treatment in the primary care setting. It's worse in the rural areas because we have retiring physicians who have been dealing with problems with mental health, with addictions, with pain that make them not want to stay any longer in the business, and it makes other people not want to go into the primary care areas. They really see doctors struggling with not having the resources to treat people with mental health and addictions problems. And in fact, Washington State is every year higher in terms of suicide rate than the nation. And in fact, our suicide rate is 50% higher than in King County in Seattle. We don't have as many resources, and therefore we have a higher suicide rate. There's no question that people with mental health problems, the severe and persistent kind, often are severely paranoid, they're delusional. It requires an intervention such as medication to even get them to realize that thinking about shooting a bunch of people is psychotic. In these situations, we need to be looking at the whole person and changing our medical model. And thankfully, the new physicians in training, they understand that, and I think they're going to do a better job of focusing on the things that can prevent health problems and help their patients change behaviors along the way. I see a lot of change in the future of mental health as far as it being provided through collaborative care models, often through telepsychiatry, or the extension of using technology. We just are wrapping up a project where we would link clinics together, and these were out in the rural areas, just through webcams on their desktop to present cases. And these are very complex cases, and we would have a group of experts, for example, in Seattle or here. I participated at times. So that's the thing, more awareness in the community, less stigma, being more able to talk about these things openly will help people get the help they need and hopefully prevent these horrific outcomes.